She's putting the puzzle pieces together with her tiny hands. She's unaware of what she's been through.
She was first diagnosed with it in utero, but they said she might develop normally. We hoped for it, but no luck. Her condition worsened. She had a severe jaundice. When we went out, she would attract some strange glances. Since we had matching blood types, I volunteered to become her donor. The causes of liver disease requiring liver transplant are different. Most adult patients who undergo a liver transplant have chronic hepatitis C infection, long-term alcohol abuse, fatty liver disease, whereas most pediatric recipients require liver transplantation due to an inherited liver disease or hereditary abnormality. Another important reason is that since most of the donors are adults, we need a surgical approach to cut down adult livers to fit small children. But while doing this, a clear understanding of surgical anatomy and physiology is needed. Therefore, it is necessary to have the experience in pediatric liver transplantation.
The organ transplant team gathered for baby Shura, focused on achieving what's considered impossible.
Her liver didn't produce enough bile. She wouldn't pass gas. Her belly started to swell. If we had to wait a bit longer, she would go into a coma. Organ transplantation is not just a job the surgical team can tackle per se. You need to have a competent team and high-grade medical facilities. Our advantage is that this is a university hospital. There are faculty members in every department. Any intervention can easily be applied, and the medical staff is very experienced. The size of the medical team makes it possible for us to do the transplants in patients and to deal with complications. Because the care and assessment of the organ transplant patient is very much different than a regular patient. An experienced medical centre that knows the transplant patients, that makes the real difference. The surgical part of a transplantation is just 25% of the job, but the rest, I mean the 75% of it, is about the post-operative care. With good care, your success rate will increase. Our success rate is around 93%, which is a pretty good rate. I think one of the highest rates in Turkey.
After the transplant, appropriate follow-up care is needed.
I underwent the transplant procedure, which went smoothly. I had a short stay in intensive care unit. Frankly, I didn't care if it hurt or how they cut me up. She is my own flesh and blood. I first looked into her eyes. They looked normal, as they're supposed to look. We were grateful. They discharged us and we went back to our house.
We have a vast liver transplant team. The aim is, after liver transplantation, to restore their health so that they can run around, play and go to school and reintegrate into society. In the first months, we perform more frequent checkups and follow-up examinations. Since we prescribe them several drugs, which are called immunosuppressive drugs, they face a higher risk of infection. They should be more careful. After 6 months of undergoing transplant surgery, we lower the doses. We also inform their families about maintaining a healthy diet and how to protect them from infections. In a sense, we become like relatives with our transplant patients. We provide follow-up care and we keep in contact with them. We perform their operations in the best possible way, discharge them safe and sound, and we do our best to support them medically and emotionally along the way. Shura gained her health back after a successful transplant, and she is now ready to pursue her dreams.